The message is clear. We need transparency, accountability, and patient protection. So what do you think legislators in New York should do?
And others will realize that it's to their benefit to actually require more transparency, not less transparency, so we can make sure the savings are being used to help the people, so we can have better health in our country. People don't have to have a car, and those without. Every place where there's a covered entity will be a quality hospital providing quality care.
Precisely. And if you're doing great things with the money, you would want to tell the community and everybody about it. So, Raven, from a patient perspective, yes, what would you want legislators to know? What would you want these groups to know to advocate on behalf of patients?
I think it would really be the importance of the transparency and people seeing and knowing what they're eligible for, what they're receiving, and ultimately the cost breakdown. What I recently noticed going to one of the larger pharmaceuticals facilities here is when I got one of my prescriptions, I wanted to know, well, what my insurance covered. And it no longer had like the breakdown on that little sheet there. And so I asked the pharmacist, I said, well, what is my insurance covering? And, you know, did 340B kick in on this? Like, what's happening? And she said, oh, well, we don't put that on there anymore. You have to wait and look at your explanation of benefits when your insurance processes it. She said, because of HIPAA. And I thought, it's secret from who? Like, this is my information. I didn't send someone to pick it up. I want to know, you know, how we're deriving at, you know, what the balance is. It's the transparency. And unfortunately, what I've ended up doing, you know, I grew up in Plainfield, New Jersey. I lived in New York now for about the past 10 years. I consider myself a New Yorker, but I have found that a hospital on the West Coast, things just flow. It's just very transparent. I have no issue getting a receipt, finding out who paid for what. My biggest stress has been, you know, what are the hours of the pharmacy? And, you know, I can get the prescription, you know, at cost that I could afford. And I'm able to do that now, but I don't know what tomorrow might bring. I don't know what my medical condition. Will I be able to handle a 5-hour flight to even do that? My goal is to really stay within my community and get what I need here. And it just really needs to get fixed because other places are doing it seamlessly. So it can be done. I do believe that 340B works. Why it's not being done in that way here, I don't know. It's discouraging, and I hope to see that change.
Excellent. It is absolutely absurd that you have to travel across the country to get the care that you need, that you should absolutely be able to get here, especially in New York.
Yeah.